Warning: this video was created for educational purpose. The main goal is to provide scientific and public health related information in an understandable, easily digestible manner, with a portion of humor. Might contain disturbing disease-related images and information. Hello and welcome. In today's video we will talk about epidermodysplasia verruciformis. Well, what does it actually stand for? Epidermis is the upper layer of your skin. Dysplasia stands for abnormal growth or development of an organ or cells. Verruciformis is made up of two words. Verruci stands for warts, formis, well, forming. In other words, abnormal developments in the upper layer of skin with wart-like manifestations. Historically, epidermodysplasia verruciformis, in brief EV, also known as Lutz-Lewandowski disease, is a rare genodermatosis which was initially described by Lewandowski and Lutz in 1922 as a congenital anomaly of the epidermis. The viral involvement in skin cancers associated with EV was only demonstrated decades later when human papillomavirus 5 genome was detected in EV carcinomas. Since then, EV has been considered a model of study of viral oncogenesis in humans. Despite its rarity, EV is a universal disease with no predisposition to gender, race or geographic distribution. The disease begins in childhood, between 5 and 11 years old. The clinical presentation has variable outcomes and is characterized by flat warts, macules and lesions. Those are mainly located on face and hands, as well as neck and trunk. Lesions that develop throughout life may undergo malignant transformation in up to 50% of cases, mainly in sun-exposed areas. Epidermodysplasia verruciformis has a chronic and progressive course. Human papillomavirus EV lesions do not present spontaneous regression. Approximately 30 to 50% of EV patients develop non-melanoma skin cancer, mainly squamous cell carcinomas. And these lesions usually appear between the second and fourth decade of life. Shockingly, a malignancy index of 62% has been described, with development of cutaneous tumors in 100% of the patients with the malignant form of EV. And as to be seen in this figure, skin cancers develop slowly but are locally destructive. Epidermodysplasia verruciformis is defined as multifactorial disease with involvement of a major infectious agent, human papillomavirus, as well as genetic factors defining predisposition, environmental and immunological changes. Human papillomaviruses are small DNA viruses, approximately 55 nanometers in size, which present an icosahedral capsid without a peripheral lipoprotein envelope. While the mechanism is not fully understood, it is assumed that integration of the viral genome into the host cell chromosomes is happening, as is observed in cervical uterine carcinogenesis, associated with high-risk alpha human papillomavirus. This would result in chromosomal instability, proliferation, malignant transformation and immortalization of infected cells. And immortalization here has a negative sense, being quasi-synonymous to cancer. An interesting fact is that 10 to 92%, what a range, huh? Of patients with EV are the result of inbreeding marriages. Furthermore, high familial incidence has been reported with more than 30% of affected siblings, but with infrequent involvement of successive generations. And back to environmental factors, it is mostly UV radiation that acts synergistically with beta human papillomavirus, being the main environmental factor involved in the pathogenesis of EV. The mechanisms by which UV radiation induces carcinogenesis involves direct damage to DNA and immunomodulatory mechanisms. Radiotherapy, being a method of choice in many cancers, is of highly malign character here, being a co-carcinogen in lesions induced by beta human papillomavirus. Dramatically, there is no specific treatment for epidermodysplasia verruciformis, and the lesions are resistant to the therapies employed, limiting their use. Due to the widespread distribution of lesions and the progressive development of multiple skin cancers, the treatment of this disease becomes a real challenge. Therefore, surgical removal, as indicated for localized skin tumors, still remains a method of choice. Among promising treatment methods, topical photodynamic therapy, as well as imiquimod, a synthetic agonist of toll-like 7 receptor, have shown promising results. Epidermodysplasia verruciformis was the first disease to correlate skin cancer and viral infection, being a model of study of viral oncogenesis. However, much remains unknown about the biological mechanisms by which the virus induces cutaneous oncogenesis.